welcome to the Dark Path podcast. Today, I'm once again very happy to be joined by another of BC's nurses, former nurses, who needs to tell a very important side of the story for everybody. So this is Jocelyn Kinnear. And so Jocelyn, please say hi and let us know who you are and what you're about.
All right. Well, as we've heard, my name's Jocelyn Kinnear. I'm a registered nurse in British Columbia. I've worked for Island Health for the past 10 years, and in total, I've actually been a nurse for 12 years. Hardcore science nerd, just going to put that out there. I am a single parent to 3 children, and I was working on the respiratory unit, we called it, on Vancouver Island for the majority of the pandemic. Prior to that, I was a float nurse working all over the hospital. And I was terminated last week, actually, because I almost got the Janssen and then I backed out at the last moment because it just didn't feel right.
Well, okay.
Yeah.
Did you want, sorry, I didn't want to interrupt you. It looked like you were going to say something else.
Oh, no, I'm processing things as I go.
Okay, no problem.
I'm not used to talking anymore.
Well, I hope, that story is one where there's so many parts of that I can't really believe are really actually happening. Mm-hmm. But I suppose in a lot of ways it would be good to start at a place where a person who hasn't been thinking necessarily about what's going on too much might sort of just naturally knee-jerk reaction assume. And so can you talk about maybe how you said you worked for the last 2 years up into just recently, and that meant that you would have been dealing with COVID patients and this kind of thing. Yeah. So can you tell us about how you came to the conclusion that it's not worthwhile for you to get the jab and as a healthcare practitioner and all that? Sure,
absolutely. So I'll preface this by saying that I'm not against these vaccinations. A lot of my decision has come down from not wanting to give into this pressure. Previous to COVID, we had those annual flu vaccinations that were mandated, but we had the option either get the vaccine or mask. I did both as a kind of an FU to the system because I really didn't like them trying to dictate what individuals do with their personal health. And I never really thought that the science backed up in an acute care setting, that a healthcare practitioner's immune system somehow was a barrier to somebody else's health. I never really found the science backed that up ever. And I tried to find it so that I could write a report on it on my own time, but never really got to that point where it made sense. The only science that backed up the actual mandate was at a public health level, not in an individual level. In acute care settings, aside from less sick calls. So that's a good reason to mandate it, maybe, but at the same time, everyone's different, and having this massive mandate just come down and so heavy-handed, it gives me so much anxiety, especially knowing that a lot of healthcare professionals got their vaccines while crying because they really didn't want it, but they had no choice.
Yeah. Well, you hit on one of the big elephants in the room. And I'm starting to think of it like there's not just an elephant in the room, but there's a herd of elephants in the room right now. Yeah. But this one definitely stands out to me because there's a guy I follow named, 2 people I follow, Brett Weinstein and Heather Heining, I think is her last name. And they're both evolutionary biologists, and they have a podcast. It's a good one. And he recently said, and I think this captures this, is I can conceive of a situation where you would have to mandate a vaccine, but it would have to have at least 3 components. One, it would have to be a super deadly virus that had no differentiation based on the demographic of the person, the age or whatever else, right? It's just everybody's going to die if you get it kind of thing. Okay. Second thing, the vaccines would have to work. Absolutely. They'd have to absolutely cut down transmission, period. End of story. And then the third thing is that the people that were administering these mandates would have to be people that really felt trustworthy and had integrity and had never ever misled the public in any way. And so if those three things were in place, I could entertain the concept, okay, maybe in some severe situation that would be necessary, but those three things aren't in place here.
No.
And so, and again, you touched on a major elephant in the room, I think, which is if you've been working with COVID patients for the last year and a half, and you have a real understanding of the immune system, you know that means you should be protected enough, especially to take a personal choice, I would think, to go into that situation. So can you, because I don't understand why that concept of natural immunity is just not being discussed.
It's the weirdest thing. It really is. It's like, yeah, we don't trust our immune systems anymore. And we don't trust our professionally trained people to prevent infection spreading. Like, we have personal protective equipment. We have like preclinical checks where we make sure that we're not feeling ill or sick with COVID whatsoever. We're washing our hands properly. Like, we're doing all these things. And I don't believe my hospital had a single case of a hospital-acquired infection with regards to COVID, which makes like the mandating this vaccine just mind-boggling. Like, it's not gonna reduce the infection rate or it's not going to reduce hospital-acquired infections because it's already at 0. So like, science,
Yeah, that's see, statements like that almost sound like they're comedy versions of reality, right?
Is this South Park? I don't know.
Yeah. But this is something else we can get to, but I want to stay with this topic. But just as a side point, I'm hearing people now that claiming to me that by vaccinating children, we're going to end the pandemic and it's going to just stop. And it's like,
No.
what? But we'll come back to that. But,
okay.
But
you didn't get me fired up here.
Yeah, well, there's so many things here, but okay, I want to come back to this one elephant, because each elephant in the room, I think, has multiple components of it. And this is more philosophical ultimately in a way. So there's almost no discussion or awareness placed into natural immunity. And as you said, that's of trust in your own body's responses and your own relationship with your body. I get the feeling that that's philosophically right at the crux of a lot of what's going on, is people that don't have a sense of trust in their place in the world. Their lives aren't framed within a perspective in which they believe in a greater good that they're a part of in some way, that it's all disconnected and just random particles flying through space. Do you think that there's anything to that, maybe?
So there's kind of 2 points there. The natural immunity, how we've kind of lost touch with how our bodies are designed at a biological level to deal with viruses and bacteria. We live with them all the time. And so like this new virus comes out, okay, sure, some of us might get hit hard with it and that sucks. Ooh, that was a really bad way to say that. But okay. Every time we introduce something into our immune systems, it's not always a bad thing. It's going to prepare us for the next time. And to take out the nature portion of that, I don't know. To like interject. Circumventing nature is what somebody called it. And I thought that was such a great way to put it, because like we've been here on Earth adapting and changing to all these viruses and all these bacteria, and we've been doing it. Okay, sometimes we do need medical intervention, but to just completely disregard the fact that we have been handling this previous to this because we have immune systems is just, I don't even know if that makes sense. I feel like I'm rambling, sorry.
No, you're doing great. You're doing great. And because as I said, like there's like the scientific physiological component to this, where there is an immune system that people have evolved with, but there's the perspective in the mindset of the person who, it's like, I don't trust myself, but I trust the doctor, because the doctor has a label attached to the name and a white coat, and therefore I can sort of export my own intuition out and just say, you're gonna make decisions and I trust you as the authority completely. Yeah. And that is a deep, to me, because I get very philosophical. I like to think about these things. It's a relationship to the idea of like, I don't have enough, like a person wouldn't have enough confidence within themselves to stand up and make their own decisions. They have to sort of export is the word that comes to my mind, their sense of trust in what is best for them in that sense.
Yeah. I feel like the media and social media, mainstream media, social media, all those things, and our communities, our friend groups, our echo chambers are all kind of making everyone doubt themselves in that way that you're saying. And it's especially exemplified when you see how people interact with one another.
Mm-hmm.
Like, wow, are we ever villainizing some people for like no reason? Mm-hmm. It's a weaponized empathy, I think somebody called it, where it's like, do you not feel bad that you could potentially possibly risk somebody else's life in this way by not getting vaccinated, when it's like, what? That's like quite the stretch.
Yeah, but that's all base emotional responses. So one of the things that keeps coming up with this too is that it seems like a lot of the motivation is coming out of a fear thing. So it's a fear response.
Mm-hmm. Absolutely.
And to me, it's really well documented that fear is not a great place to make decisions from.
No.
And but that's never ever. But see, that to me, that ties in with the lack of focus on individual responsibility for health. So there's no like the government's not saying, hey, get out and exercise every, whatever intervals you should do, eat healthy, sleep well, all that kind of stuff. But if you did say that, what you'd be saying is you can take responsibility and do a lot of good for your own health. You can do it yourself. But if you're coming from a place of fear, you want that external authority to say, no, this is what you do. And then you don't have that sense of responsibility anymore. And it's hard not to believe the government isn't doing that on purpose at this point. And that's really concerning. Yes.
It is. It's really scary. I don't know why we're not putting more, encouraging more personal accountability and responsibility on our own health. And like the lockdown certainly didn't help.
Well, yeah.
You see the statistics of like cardiac events increasing. Could that be the vaccine? Maybe. Could it be the lockdowns? There's a good chance that they are absolutely contributing to it, because we're adapting into like this more sedentary lifestyle. And when we're in that panic mode, we're gonna self-medicate however way that might be, playing on video games way too long, or eating really crappy food, drinking more alcohol, drugs, even. All those things can contribute to a poorer health outcome. And like increase that risk of blood clots just from sitting around.
And I mean, on that note, one of the things I've been following that I think is just horrific is the incredible increase of overdose deaths in the last year. Right. And I can't believe those things are disconnected. Gosh,
they have to be. They're so intertwined. And not only have we created an environment that is just absolutely abysmal for our mental health and well-being, we've separated ourselves, isolated ourselves from our friends and our families, sometimes because of that fear. Like, well, we don't want to get COVID, or we don't want to get somebody else infected with COVID. So we're going to just not go out. We're just going to not interact with other people. We're not going to have that support network that we've always had. And on top of that, you also have, where did that thought go? The mental health, like that fear and not feeling like you can be perfect enough. You have to be perfect in today's world. You have to be doing everything you can to prevent COVID. You have to be just being polite to everyone while also hating them just a little bit. You have to be like, just, if you're not perfect, it gets called out on like social media.
So there's that's, I know what you're saying, but I have this belief too, like, again, it's kind of philosophical, but I have this belief that ultimately people know when they're lying to themselves. They can't really completely fake it to themselves completely. And so a lot of the measures aren't really working very well or working at all. And there has to be like somewhere in the back of their mind, this simmering, brewing knowledge that what they're doing is just theater and actually not helping. And then of course, whenever you develop that kind of relationship to reality in some way, a pathology emerges out of it because the energy is being blocked. The dynamic is being blocked. You're going to start and then we get into what I think is one of the scariest things I've ever seen in my lifetime, which is this desire to blame the unvaccinated or the unclean and to cut them out of life in any way is so dangerous and crazy.
And they feel okay with it. They feel like superior about it. Like, this is great. You know, we're fucking them over. Sorry if I don't know if I can swear, but
please, this is open-ended. You can say anything you want.
Okay. I've turned into quite the sailor during this pandemic, gotta say.
Well, this is one of the things I love about podcasts is it's not for TV, right? You can truly openly talk. And one of the things that about having you on, and I had Fallon, who I believe is your friend on, I guess, or you know her, is this is conversations you would never hear any other way.
No, yeah.
Yeah, it's conversations that are happening all the time. Right, they're all over. So let's make them let more people be aware that, hey, there's other people having other thoughts, and they're worthwhile thinking about.
It's good timing too, because like we're all fired now, so we don't care. Well, we can be honest now.
Well, no, that's what Fallon said too. Like, I was like, okay, well, that's make the best of it. I mean, So let's go back to the last 2 years, though, in terms of the play out and the experience of it, because for me, when it first popped up, I definitely gravitated towards being very cautious because I didn't know anything. And there is a potential in the world for horrific pandemics to occur. So, okay, let's check it all out. But then
Ebola was quite the disappointment. Go on.
I don't know a whole lot about that, to be honest. But maybe that'd be interesting. My thought was, so that was 2020. By the fall of 2020, I realized that it doesn't seem like this disease is bad enough to warrant the extreme response. And so the wheels started to turn.
Yeah.
And then I still, at that point, believed what they were saying about the vaccines being a cure and they're going to fix this and we're going to come back to normal. And I actually believed that they wanted to go back to normal at that time. And then 2021 comes and, it's all held back. And I keep going, what the hell? But then May of 2021, Dr. Bonnie Henry is on film saying that we won't do vaccine passports. They're too divisive. We're not going to do it.
Wow.
And then in August, it was announced, I believe, so it's May, June, July, August, just 3 months later. And it was like a punch to the guts. I just went, what? How? Yeah. What the what the fuck? What the fuck is this? And that's actually what sort of the seed of the podcast was too, is to get that other side of the story out. But so anyways, that was for me, that was the moment the penny really dropped. And I said, holy crap, we got to start to look at this differently.
Something's going on kind of thing. Yeah.
So, so from your perspective, especially working in a hospital, I'd love to hear how you saw things play out.
Sure. Yeah. So admittedly, I'm in a semi-rural area, so we didn't get a huge wave the first time around. So it didn't really I tried to keep that in perspective. Like, I'm not really seeing like the deep pits of this pandemic because I am somewhat rural. And my population is mostly geriatric, really older people here, lots of comorbidities. And our hospital is so small. It's like under 200 beds. So we converted one of our units, the respiratory unit, into our COVID unit. And anybody who wanted like CPR or critical care interventions, we actually shipped out to Nanaimo or Victoria. So we didn't get the really sick, super sick people, but I also didn't really hear a lot of like people coming in incredibly ill. So I was like, oh, okay, so this seems a little, odd. I thought I'd see a couple, like we have the perfect population for this to go haywire. And it never really did. And we had COVID in the community a couple of times, and we're actually in the middle of a wave right now. Good luck, hospital. So like that kind of just made me kind of think that this is just something that's just gonna, play out pretty quickly. Like, we're not gonna get hit too hard or anything like that. And then the vaccines started rolling out. And I thought it was really cool because I followed the mRNA technology as it was kind of being developed, because I was watching it for cancer studies, because it's still in clinical trials for different cancer types for treatment of that. So I was kind of excited to see it come out. I didn't want to be the first one because, like, wow, I like science and I like to see how things play out. So I saw my coworkers get vaccinated, and one of my best friends had a systemic rash. So he like was like red from head to toe practically right after his vaccine. And I was like, oh, I don't know if I want to do that. And at this same time, I was also researching COVID itself and what the pathology behind that was and how it affected our body. And most of the research that I found was related to the spike proteins. Of course, the vaccine is a subunit, or it produces a subunit of that same spike protein, which if it does shed out of our cells, which they told us that wouldn't happen, but that was a lie. If it sheds out of our cells and fuses with one of our cells, we get that uptick of inflammation, a huge inflammatory response. This is things that they're not admitting to, but it's like that's what the microbiology is showing. So why not? I don't know. Why not say something? But at that same time, knowing that we were like using a vaccine whose intention is to produce something that's like pathologically not good for us, it just didn't make a lot of sense in my head. I understood like how it would create immunity, of course, but like it's just like, should we have used that piece of the virus to make this immunity? Because it seems like it's affecting, or like it's attacking ourselves essentially. In that same time, I had another coworker who had incredibly painful skin rash that had them off work for quite a few months. Another one ended up in the ER just from severe abdominal pain. My best friend who had that systemic rash, his best friend since childhood, died within a couple of weeks of the vaccine from a heart attack. He was in his 30s, no pre-existing issue. And I understand that can happen sometimes, but it just seemed fishy. And then I saw people come into the hospital also having unusual things happen to them pretty close to when they had their vaccine, like a lot of shingles activations. You see a lot of shingles, especially in the elderly, and some weird coagulation issues, blood issues. So like here I am, not seeing a lot of COVID cases, but seeing a lot of potentially some reactions potentially linked to the vaccine, but nobody talked about it. And that's just kind of what seeded in me, like, something's not quite right here. Like, how come we're not talking about this? Like, we're seeing this connection between like shingles and the vaccine. And if you're older and you get shingles, you can get into this general decline because you're in so much pain. You're going to be in bed for a couple of days. And one day in bed is like 2 weeks of therapy to get back any muscle loss when you're at that older age. So in that general decline often leads to death just because of the age group, right?
Yeah.
So the vaccine just didn't seem to be the best product to help us out of this.
Yeah.
And just the fact that we can't say anything about it. Oh, and then the BScN even said, like, you guys aren't allowed to question public health orders at all. And it's like, well, that's actually part of our nursing training, is to ask questions, especially if it pertains to public health.
Of course. And as you, I don't know if you said this exactly, but you've been sort of saying this, is that's not science. Science is to ask questions, to look at results over time, and to like, to me, and I'm not a scientist, I teach martial arts for a living. It's kind of a science, I guess. But it's that you look for every hole in the theory you can, and you fully explore that hole, because that's the only way to actually know anything. But okay, I want to go back for a step though, because you brought up a bunch of really interesting points, and one of them is I am interested in the correlate between the spike protein idea, because again, I'm not a scientist, so I'm just looking at this from an outsider's point of view.
Oh, good. Yep.
There's the spike protein thing, and it exists within the mRNA vaccines as well as the virus, and it ties into inflammation issues. But I also have heard and read and seen in studies that hypertension and obesity and other comorbidities that cause inflammation are massively contribute to a worse outcome with COVID. So in a way, this is all spiraling around this inflammation issue. And, that's important, right? Like that's an important part of your health in a bigger sense too, right?
Absolutely. Yeah. Yeah. Inflammation is pretty much the cause of almost every non-communicable disease.
Mm-hmm.
So like heart attacks, especially.
Mm-hmm. Mm-hmm.
Because if you have inflammation in your arteries, they're not going to expand with your heartbeats anymore. It's going to cause like scarring on the arteries or in the vessels, and that can cause an area for blood clots to kind of bump up against.
Yeah,
and it can blah blah blah. Too long didn't read. Inflammation can cause blood clots. It can cause a lot of adverse outcomes.
Yeah.
And our lifestyles are like tailored to inflammation right now.
Well, yeah. So I actually, on a personal level, I need to research that more because I find it fascinating how the body produces inflammation, and the idea that it's kind of at the root of it, it's like it's an attempt at a sort of a flushing of the system in a way. It's trying to heat up to boil off the bad stuff in a way. But then it just overdoes it, right? And especially you could get to the extreme of like an autoimmune disease where there's an overreaction that just can't be contained and all this. But to get back to more like practical to the time we're talking about, is so Africa. Recently, there's articles about Africa basically not having COVID issues on a large scale. It looks to me then that like maybe that's the reason, or a big part of the reason is there's not as much obesity, there's not as much hypertension. The people they're a lot leaner, they're a lot fitter.
Yeah. Well, if you look at like the United States, what the hell is going on down there? Like, whoa, they are not doing good whatsoever down there.
Are you talking as a whole? Okay. In terms of COVID, there's some countries that are doing some crazy ass shit that is, to me, worse than the States are doing in terms of COVID response. Like Australia, right? Like,
oh my God, Austria too.
Yeah, whoa. Austria, yeah, all that stuff to me that's further, like the Americans, at least, and their court system is pushing back against the mandates.
Yeah. I was just more talking of like their overall outcome. It's like, what's going on there?
Well, I heard that around 40% of adult Americans now are statistically obese. So that's pretty crazy.
That's a large number.
That's a large number. And that, of course, as you know, is like, that's not just like you're a little overweight, that's a serious amount of extra. And then it always comes with more comorbidities, the amounts of diabetes, the amounts of all of these other things. But so that goes back to actually something we were talking about, is like that taking responsibility for your own health. It isn't, and then we live in, and like you've been saying, we live in this cultural market driven world where, like everything's crap. The food is such crap, and it's so cheap and available, and you can eat so much of it, and all this stuff. And we just fallen away from having that relationship to our own health in that way, in so many levels.
I know there's so much to talk about.
There is. It's every elephant has like 100,000 elephants in it in a way, right? But okay, so that's one major element, is the natural immunity, the lack of self-responsibility for your own health. Another elephant in the room thing that if you want to speak about, I'd be curious, is like, do you think that some of the what I would call the low-hanging fruit in terms of COVID needs to be discussed more? So it's like vitamin D, or just actually one of the things I was thinking about, and I got this because I pay attention to all these different places in the world, is like a blister pack that has vitamin D, maybe a high dose vitamin C, just some basic sort of supplementary elements that you give to a person when they come down with COVID, instead of just sending them home and letting them,
Yeah, the outpatient response that we have to COVID is just not there.
Well, yeah.
Like you come in, I think I got COVID, you test positive for it, and they don't really do anything for it. And it's like, well, there's a lot of things that we can do to help our immune system, boost up against viruses. And vitamin D and zinc is one of those like primary ways that we can prevent the virus from entering our cells and replicating.
Hmm.
So it's like, why are we not encouraging people to,
So
take things at home?
did you ever get a memo coming down from above that spoke to why there was no outpatient treatment at all?
Not really. No.
That seems so strange to me because
Yeah.
it's like one of the things that came up with when I talked to Fallon is a difference between the person nursing and the person sort of managing the administrative element in terms of their perspective. Yeah, yeah.
Yeah, they're not together at all.
Right. And that seems to be why maybe that could be played out is the administrator goes, I don't want to think about anything other than, my bottom line and my PR issues and all this kind of thing. Whereas, if you want to help somebody, even giving them a cup of tea that helps them calm down would be helpful, right? Like something.
Yeah.
So
Yeah.
yeah, that one bothers me, but that ties into a big thread, which is what the hell is going on in terms of this? Because at this point, it's undeniable that there's some bias and agenda towards to this one narrative, and you get into the conspiracy world. Dangerous elements of that is like, well, I want to say it's going to this point or that point, but what the hell is going on?
Yeah, it just doesn't seem that it's very patient-centered, which is like what healthcare should be, patient-centered. There's not a lot of prevention going on outside of like lockdowns and wearing a mask. And is that helping us? I don't know.
Well, it doesn't shown itself to be terribly helpful, right?
No, and it's shown to be a little bit on the bad side there.
Yeah.
We prevented our kids from getting the simple cold for a while there, or even the flu, because they were wearing masks. So their immune systems, like there's a chance they got a little bit lazy over the last year or two.
Yeah, but that's like an awareness of the natural dynamic of the immune system, which seems to be nowhere a part of this. But okay, so if we go back in terms of like COVID occurs, everybody, including myself, was kind of freaked out initially because we didn't know. And then the data starts coming in and saying that, oh, you don't need to be super concerned. Some focus, some care towards people that are particularly vulnerable would be a good idea. And all this kind of like more nuanced understanding could have come up. But instead, there's this doubling down on these interventions. And for a long time, I allowed the majority of people that fell into that to be sort of, to me, coming from a fear response still, that it's taking them longer to snap out of that. And I think that's true. But the other element that I think is coming out there is I think that Donald Trump broke a lot of people's brains. And
that's one way to put it.
Yeah. And so like, I don't like him. I was never a fan of his. I'm not supporting him in any way, but I also wasn't convinced that he was the greatest threat to the world that had ever occurred. And so that middle ground, you get lost in that middle ground, but the extreme response. So anything he said was bad, right? So, right. And so he comes out and he says that he got hydroxychloroquine when he got COVID. And so hydroxychloroquine is bad. You can't possibly. Yeah.
Done.
And that kind of thing. I went, holy shit, this is actually not a fear response. This is tribalistic, political, ideological games that you're playing.
It's so political.
Yeah.
So incredibly political.
With people's freaking lives. Right?
Yeah.
Because I mean, on one level, COVID's real and that there's certain people that are very vulnerable to it and should be taken care of. And we should do that. But then another level, there's people like yourself whose livelihoods are tied up with jobs that are now being taken away from them because of a political game. Like it's crazy. Yeah,
I can't believe how far reaching that mandate was. Like people working from home were caught in the mandate.
Yeah.
Like, how does that make any sense?
Well, yeah, sense is not a part of this. It doesn't seem.
And they made sure that we don't get like EI or we don't get our, what's it called when you get terminated? Severance pay. We didn't get anything. They made sure of it. They rewrote rules so that we would be totally fudged.
Yes, no, that
we didn't comply.
See, that speaks to like actual resentment, like an actual like angry, hatred-y kind of vibe. And what the fuck is that?
severe coercion, layers and layers of it even.
Yeah. So I have to wonder what the motivation is, because that isn't, they're obviously not connected to public health in a real sense.
No.
But you want to be mean to the people,
Yeah,
like
exactly.
why? Especially people like yourself, who's literally been helping this whole time and doing what you can in your hospital, like you said, to help. Like, you're taking those people's livelihoods away, and you're doing it in a way that's like transparently cruel. Like,
Yeah, and people support
and people, well, there's a lot of people.
some.
Well, I have this hope. I got my fingers crossed that more and more people are starting to shake their heads and go, wait a minute, what? And I think a big part of that now is, I think it was today that that they were talking about how the boosters are just going to be ongoing, that you're not going to, like, it's not like one more and you're okay. It's going to be just a process.
A subscription service to your own system.
Yeah. And I mean, I have to believe that that's too far for people, a lot more people, at least. It's hard for me to fathom that if it isn't. Yeah.
I feel like people are definitely starting to wake up a little bit more and more. But the ones that are, it's going to be really hard to convince people that they have been lied to.
Yes.
What is that saying? It's harder to convince people than it is to convince them that they've been.
Yeah.
Dang it.
It's
there in my head again.
It's easier to fool somebody than it is to convince them they've been fooled.
That's the one. Yes. And that's very true right now.
Well, yeah, because that ties into your ego, right? And okay, so this is a perspective that ties into the whole thing that I've developed largely through working in a martial arts industry for a long time. So I've been training for a long time, and I've been teaching for about 10 years. And I've seen a lot of people come through the dojo. And one of the big things that you learn in martial arts is confidence, actual confidence. But there's this misunderstanding where a person who doesn't have a lot of confidence will assume confidence means being like boisterous and over the top and kind of push your way around. And what that really is generally a bully. That's not a confident person. That's just a kind of a overwhelmingly intense person, maybe. But real confidence changes your perspective, and you step back and you're able to assess things more from a neutral standpoint and all of these things. And so you see in the world, I see in the world, a lot of people that they don't develop a sense of confidence, really. Because it's not emphasized in school. It's not emphasized in a lot of people's concepts of themselves. They just go to work, or they just do the things they do. They don't think about how they can improve their sense of self in that way. But so when a person does that, they become very fragile and very responsive to anything that might poke at their sense of identity and ego. And right now, if you're on this political team that's all supportive of all this craziness, then that ties to your identity. And then if somebody pokes at that, they respond as if you're poking at them as an individual rather than as the.
Yeah,
right?
yeah, it's very personal for them.
Yeah, which doesn't seem logical, of course, but we're not dealing with logic necessarily.
Nope, not anymore.
So how do you like? Do you feel like you know how you managed to evade that behavioral sort of dynamic?
I'm stubborn.
Okay.
I'm a very stubborn person.
Yeah.
But I think most of it is well, I think like I would have gotten the vaccine, I think, at some point if I didn't have my mom, who is staunchly anti-vaccine. She hasn't always been, but she came down with a chronic illness quite a few years ago, and Western medicine just kind of dicked her around essentially for a long time, not wanting to treat it or treating it incorrectly and making it worse. And so she, with her help, she kind of planted a seed of just like, questioning things, have a little bit of doubt on things. And then, so that paired with just the fact that I'd been following COVID and the spike protein and the pathophysiology behind that, I think that's one of the reasons why I was able to not succumb to the pressure.
Yeah, well, you, I mean, as you know, like there's lots of reasons you can come up with logically to question this stuff and to hold back. But what I wonder about is people like how they just naturally have the internal strength to just to have that, to be able to say no, to say that no, this is a line and I'm going to hold that line. Because a lot of people don't.
No, yeah. Yeah, actually, you know what? I usually cave to pressure, honestly, but I don't know, for some reason, this one just really
So,
stuck out. And I think that was the stubborn part of me
but,
going like, oh, you're going to threaten me with this now?
well, that's cool. That shows a bit of what we call a fighting spirit in martial arts. But underneath that sense of stubbornness, I would assume there's an intuition. This is the right choice to make.
I feel like that is, that's definitely true.
So that's interesting to me though, because I think maybe there's people that cave to it, they don't develop that sense of intuition. And I don't know how to, some people have intuition naturally, so you can develop it somewhat, but a lot of people they just have their relationship to their intuition is just how they were born, right? It's part of that.
Yeah.
So do you feel like you've always had a strong sense of intuition?
Oh, yeah.
All your life? Yeah.
Yeah. I've had some weird things happen just based because of my intuition.
Oh yeah. Do you want to share a story?
Might make me sound like more of a weirdo, but yeah, let's go for it.
Hey, this is what this podcast is for.
Like, I don't know if this is like really relevant, but okay, here's my tinfoil hat. It's going on. So like, we're electromagnetic beings, right?
Okay.
We share energy with the world. And it's scientifically, that's true. Okay. I'm not that weird. Maybe I am. But I knew exactly when like my first dog died. I was at school. I just immediately started crying. I knew it. They were dead. So things like that, or like waking up when you know that a loved one has passed, things like that. You just kind of have that intuition of knowing things. I can't really think of anything else off the top of my head, but like I know there's like things on like day to day where you just like, I don't think I should do that right now. And then something happens where it's like, oh, good thing I listened.
Yeah.
But some intuition is definitely like a subconscious thing where it's like you have that knowledge there, but it's not at the forefront. You're not actively thinking of it, but the intuition's there. And like just
But yeah, so I'll share a story too, and then try to talk about how that relates actually a lot to what's going on. But so this is a story. Me and my brother and my dad were out hunting up in the north when I was a kid. I think I was like 15 or 16, and my brother would have been like 13, 14. And so it was not a successful trip. We weren't finding any animals, and just sort of walking around in the bush. So it was nice, and for that. And anyway, one day near the end of the trip, I think it was the second to last day or the last day, we were exploring a valley, and the valley was really dense with undergrowth. So it was hard to see very far, right? It was, and there was this claustrophobic feeling in the valley. And I remember walking into it with my dad and just getting this sense of weightedness. Something about it didn't feel right. And we walked for a couple, I don't know how far, maybe a kilometer and a half, not too far, not that far. And I said to my dad, Dad, I think we should go. I don't like being here. And there was no logical reason, right? It just didn't seem right. And he kind of picked up on it too. And he was like, yeah, let's go. This is no good. So we left. And it was the last day we had to go hunting, because the next day we left. So we left the next day, and we're driving out of camp, and we came across some guys that were doing some work on a train track that was near the road. And they had a little, you pull up and they have the flag guy, you go through the road that way, right? So we pulled up to the flag guy, and there was going to be a couple minutes to wait while they did some work, and started chatting with him, and noticed that he had a double barrel shotgun sitting on the back of his pickup truck. And we were like, so what's going on? What's that all about? And he's like, see that valley up there? And it was the valley we were just in. There was a mother grizzly and her cubs were crossing the road, and one of the cubs got ran over, and the mother lost her mind and started attacking the truck. And then she seems to be living up in that valley, and she seems to be coming out. So we were like, holy shit. So
good intuition.
Yeah. So again, like you said, right? Like you can't explain it in like a perfect scientifically diffused way. But that actually happened. My dad can attest to it. My brother can attest to it. I'm very grateful we didn't go further into that valley, for whatever triggered that response, right? It meant something. Now, this again ties to this concept of trusting your own immune system, trusting your own self, because you have this guide there, right? So yeah, I feel like that's one of the major components that, if we were going to look at like getting the world to a better place in the long run, that needs to be more drawn out, is encouraging people to trust themselves a little more, and in that sense. Yeah, that's a whole other thing.
It's just, I feel like, a lot of the people who are in, I found so many people, so many amazing groups on like Telegram, Twitter, even Facebook, and Signal, I think was the other one.
Yeah.
Oh, hi, Annie. But they're just so supportive and amazing. And a lot of them are like, I just wish we could just run away into the forest. Like, yes, let's do it.
Yeah. No, I hear you. And okay, so here's a thread that we could pick up on this with. Is you wanted to preface your little stories about hi. You gonna say hi to the camera? That's okay if you're okay with it. You know, say hi. It's fine. When you talked about your intuition stories about the losing the family dog and that kind of thing, you give it. You said, "I'm going to put on my tinfoil hat and I'm going to preface this and all this." I think that's one of the problems too. Is you can be scientific and rigorous and serious about as concrete a reality as you can aim at, but you can also explore and be open to possibilities that you can't contain within that framework.
Yeah.
Right?
And I hate the science community when they're like, well, show me a source for that. It's like, I can't source my personal experience. But I mean, we don't need to concretely prove everything that happens.
Yeah.
Did you just put on lipstick?
Well, we can sort of wind this up too if you need to. I don't know if that's.
She might exit in a little while.
Okay, well, we'll keep talking if you want though too.
Yeah.
Okay. So that's interesting. Okay, so I also been having a conversation.
Over here.
You're gonna conversation.
I'm gonna ask your mommy a question, and then if you want to help her with the answer, you can do that.
Yeah,
okay?
let's see what he's gonna say.
Okay.
Just unplug the headphone.
So what was my question? Oh yeah, okay. It's a thought. So if you want to pick up on it a bit, because there's definitely elements of life, right, that can't be contained within the rigors of like scientific measurements, right? There's this other component, and it has its place. And it's not that means you shouldn't be serious scientifically, because obviously you should be. The other way that there's a correlate to this to me too, is morality can't be put into a scientific framework in that sense. What is morality? How does it exist? Why do we need to have it in society? Well, it's actually very, it's abstract, right? It's disconnected from material.
Right.
So,
Absolutely.
So it's kind of similar. Like, do you want to live in a world where everything's measured materialistically, and then you never get a chance to question the diktats of the people in charge? Or do you want to live in a world where you have a working dialogue towards a greater sense of morality that we can all kind of work with?
Yeah. I think morality is such a funny thing, especially right now when we're like, there's the trolley, the logic issue with the trolley, we're like, do you flip the switch to save one person?
Oh yeah.
Or like multiple people? And I feel like that's like what we're doing with the vaccines. It's like, do you want to be in charge of that?
Yeah.
But morality is so hard to define, and it changes with every friend group, practically. Every country, it changes.
Yeah, no, it's definitely cultural, and it's definitely personal to a certain degree. But I feel like we've lost a sense of a larger scale concept of morality in society in general.
Yeah. Oh, definitely.
It's
what is it? The banality of evil.
Yeah.
Where like people, are just following orders, or they understand or things a certain way.
Yeah. Yeah. So Laura.
Elora.
Go back downstairs, sweetie. I was watching a show. I was watching Mickey Mouse.
Ooh, Mickey Mouse sounds fun. Yeah. Morality. Let's pick up on that, because that's again at the heart of all this stuff in so many ways. And for me, a lot of my understanding of morality really has come through my training, because I do traditional training, and it's very important that you learn to develop your morality with your skills. because if you don't, especially in the old days before modern weapons, you could be a very serious problem for a community if you knew this stuff and weren't caring person about it, right?
Yeah.
So that's where that all sort of builds up for me. But like, how did you naturally develop a sense of morality? Did you grow up in a religious context or anything like that?
I had agnostic parents. I don't know. I think my mom did an excellent job of just making good people. Not to toot my own horn, but
Huh.
I had no idea what racism was, because I was just like, hey, people are people,
Yeah.
little things like that were like just always helping other people. But that also became a big fault of mine, helping people out a little bit too much.
Oh yeah.
At the expense of myself.
Yeah.
But morality, yeah, I feel like it's so hard to describe what morality actually is. And a lot of like nursing education focuses on morality and ethics and things like that. So to watch this all unfold, it really goes against everything we got taught.
Yeah. So I feel like that's like a lot of people have like an intellectualized understanding of their moral and their morality and their ethics, but they still behave instinctually.
Yeah.
Right? They haven't taken that and said, actually, what does that principle mean in a moment of stress? Right.
Yeah.
And to me, that's a failure of ultimately like of education and of society is we don't, because nobody is going to develop a sense of morality spontaneously. It's going to have to be cultivated. Right? Because children are pure instinct. That's, what makes them so wonderful in some ways. But, you can't have an adult that's just going to run off the rails with their emotions every time anything happens.
Yeah.
So there's a lot of threads there, but one of my first podcast talks was a guy named Mark Hecht, and he was running as a People's Party of Canada candidate in the Cowichan Valley area where I grew up. And he talked about how, and I've heard about this before, there's no initiation ritual into adulthood in our society. And then I talked about how I kind of think I did that to myself, because not consciously, but I just put myself in these ridiculous situations when I was younger that were very dangerous ultimately, and kind of woke me up to my mortality. But do you think that's a component of it? Did you find yourself naturally gravitating towards a kind of recognition of adulthood through your own experiences?
Oh my gosh, I don't know. I had my first kid when I was 21, and I was still such a child at that point.
That's gonna definitely bring you to maturity.
Yeah. And I was hindsight, I was a pretty awful parent. Like I took care of my kid, but I was like so selfish still. I was still in that like young mindset. And it wasn't until my second kid was born that I kind of woke up and went, oh, I can be better than this.
So kids then, they initiate you.
They snap you right into it.
Yeah.
Whether or not you're ready.
That's cool. Because I think that's a very natural process that's not really as recognized for being as important as it is. That relationship, of course, too. Like I do teach little kids. I don't teach like super little kids, because when you get too young, it's impossible to really teach them karate. They
don't care yet. They're I want to play.
Yeah, exactly. But the socializing that is developed in those first few years is formative for the rest of their lives. And so the environment that their parents set up for them is so important. And so whatever that means is, because that gets you to kind of snap out of your, as you said, it's like a sense of selfishness that children have, because it's naturally they need to have it in a way. It's part of the development. But then you get into adult and you got to go, holy shit, I need to deal with a community, and I need to recognize that everybody in the community has equal right to be here. I don't get to discharge anyone. And
really like the crux of like what a lot of the social issues is right now is that caring for the community, and like, how could you not get a vaccine to help the community? Right. It's like, well, how can you not care about the people who are getting affected by the vaccines?
Well, you get blinders on, and then only what sees in front of you exists, and everything else is gone. So it really is interesting how all of these things kind of swirl together and are creating a moment where a lot of choices really do need to be made in terms of what direction society is going to go. Because I think this winter is going to be a very decisive winter. I mean,
Oh, yeah.
right. I can see this game being played with the Omicron variant, as they're calling it, where,
Yeah.
you know,
About that.
yeah, well, please, we'll jump into it. But what I mean is I can see a fork in the road about it, because you might, if you buy into the fear mongering about it, then you're going to go line up for your 4th and 5th or 6th shots because it's never going to end. Or it might be the one that gets people to go, what are we doing? So,
yeah, it's going to wake some people up, I think.
Yeah. Well, did you want to jump in about that?
Oh, yeah. Oh,
Yeah.
I'm just loving the public response to this Omicron variant, which is like incredibly mild.
Yeah.
That's incredibly like rapidly spread though. Like even yesterday, Bonnie Henry was on her live COVID update, and she was just saying like, I mean, even though Omicron doesn't really have any hospitalizations nor deaths yet, get your booster shot. Like, why?
Yeah. Why? Yeah.
I think I welcome this Omicron variant because it just means that we're one more mutation in the virus closer to being something that's more sustainable as the seasonal virus that coronavirus is going to become. Like it will be with us. It will be seasonal, 100%.
Yeah, it will be endemic, as they say, right?
Yes. Yeah.
Yeah. That's another thing that I'm curious about from the outside of the medical science world to try to look in is seasonality, right? This is a major factor in disease transmission in general, in terms of respiratory issues, right? So you said that COVID will become a seasonal thing. Is it not a seasonal thing already, or?
It kind of feels like it because we tend to spike in the winter, but I think that's just, it's not classified as seasonal because we're still in a pandemic. So
that's a bit of a definition game.
It is more of a definition game than anything. Yeah. But we're going to see the spikes in the same seasons. Just like when the flu started coming out. Wow, it came back this year. Wow. But the flu came back and now we're getting a COVID wave right now. So it's like, it's just on par with the weather changes.
Yeah. That's something I've been paying attention to for many years too, because I grew up, I had pretty chronic asthma as a kid, and every fall and winter was pretty rough. So I just naturally noticed that. But if that's the case, then there's this contention that we could repeat this goddamn pattern every year, right? Because it'll come up every year then, right? And
well, it'll be better because everyone, well, not everyone, but I don't want to generalize, but my science brain is saying, okay, you know how we have the colds, right? Colds are pretty mild. Sometimes kids get like fevers with them. Sometimes they get really sick with it, but generally very mild. And as this as COVID mutates, it's going to become more and more mild. It's just going to be more infectious. So it's going to be something that's really tolerable. And since we have more immunity to it once we have it, unlike the rhinoviruses, the coronaviruses, we're going to have some more lasting immunity. So every time we get it, it's going to be a lesser and lesser kind of disease process, theoretically. Theoretically.
Of course.
So like as we mutate into a less dangerous variant, we're going to have like more people getting immunity the old-fashioned way. Yeah.
Well, so Jordan Peterson was interviewing, I can't remember the guy's name, but he was a politician in Australia and a former politician in Australia. And they proposed this idea. And I can't remember which of them proposed the idea, but he said, okay, as of, let's say, December 15th, that's just a random date, but we pick a date and we say after that date, if you want the vaccine, you've had the opportunity to get it. We're going to open up and get back to normal. You take the chances you want to take, and then life goes on, and we'll support the healthcare system as best we can, and we'll just go from there. So that would be one where the perspective in which that you would do that would be one where you accept that these waves are going to come, and we just work forward from there without getting freaked out about it. That sounds reasonable to you?
Could you repeat that last part? Sorry.
The idea that you say to people, here's the date from which we're going to open up and go back to normal, a random date. You've had the opportunity to get your vaccines if you want them. After this, we open up, we'll support the healthcare system best we can for whatever might come up. Will we just go back to normal at that point? And the reason I bring that up is because that means you're accepting that there's going to be waves that come in with this, that you can't stop them from occurring. That makes sense. Elora, can I have 5 more minutes to talk to your mom and then I'll be done?
Okay.
Oh, thank you. Is there anything else you want to throw in, Jocelyn? Anything else that we didn't talk about?
I have so much to say, but I think we'll keep it shortish and sweet.
Yeah. No, I know you definitely. Go ahead.
Yeah. Oh,
Yeah, you got stuff to do, but I'd be happy to have you back on. We could do another chat, and there's, as you said, there's so many threads here to pull on, and
yeah, for sure.
Definitely needs to be said. So
absolutely. Well, thank you very much for having me on.
Well, thank you for sharing your story. We'll just have to wish you the best for the holidays and hope to see you again.
Happy holidays. Yeah.
Yeah.
Okay, well, take care. It was nice to virtually meet you.
Yeah, you as well.